As you know, I'm a journalist. I usually write about foreign affairs, security issues, and technology. But during the COVID pandemic, I found myself pulled into something very different. I was taken on a very strange journey. I think, like many of us, I was watching far too much TV news. And I began to wonder why so many COVID patients were being placed into medically induced comas. At first, it was just idle curiosity. I mean, how does it work? Is it like stasis in a sci-fi movie? If you ask Google, the answer seems straightforward. Coma, or prolonged deep sedation, is an essential tool in critical care and has been for the past 50 years or more. It provides a deep, restorative sleep that allows the drugs and nature to do their work. And crucially, you're told the experience will be a blank. There will be nothing to remember. But as a journalist, I just couldn't stop there. So, with time on my hands, I decided to find some coma patients and ask them directly. Now, I found them at first on Facebook, the Coma Survivors Group. And when I started listening, two things struck me immediately. First, almost everyone described a similar, serious pattern of physical and psychological after effects, regardless of why they'd been in intensive care. And second, many of them spoke about experiences during their coma, which is odd because we're told there should be nothing to remember. The brain is effectively offline. And yet they remembered. They described vivid, often disturbing experiences, nightmare-like worlds so strange and intricate that they defy imagination. Some reported beautiful episodes, akin to the near-death experience, the NDE. But most striking of all, many described living alternate lives, entire alternate lives, rich in every detail, more real than reality, they said. Lives that seemed to span years or decades, while mere days or weeks passed in this world. Well, there's a clear contradiction. You've got patient testimony on one side and medical expectation on the other. Now, medicine tends to treat consciousness as binary. You're either aware or you're not. So when patients describe complex, structured experiences, those counts are often dismissed, labeled as false memories or reduced to terms like ICU delirium or post-intensive care syndrome. But to the people who live through them, those labels feel empty. They feel like dismissal. And as a result, these experiences are rarely recorded in medical notes. And that creates a feedback loop. Medicine dismisses them, journalism repeats that assumption, and patients stop talking. To me, that's not just a medical issue, it's a reporting gap. So I turned to the medical literature, and I was really troubled by what I found. Believe it or not, there is no medical literature that advocates prolonged deep sedation. None at all. And it's not just me who's been looking. I even asked the editors at the Lancet, and they couldn't find any. Deep sedation for short periods, there's no issue with that. But when it comes to prolonged deep sedation, just about everything I could find decried the practice, pointing to the distressing physical complications of lying immobile for so long. Wasted muscles, calcified joints, disconnected nerves. And then there's what happens to the brain. Patients are left with shocking gaps in their memory. And there's scant evidence that a patient in a coma is actually sleeping. They do not go through their circadian rhythms. They can't experience REM sleep. They can't dream. They become sleep deprived. Just days of sleep deprivation can drive people over the edge to the point of madness, and that's proven. Yet the studies on sleep deprivation for weeks or months at a time have simply not been carried out. On top of that, the drugs employed are known to be harmful, even in small doses, such as propofol and opiates and ketamine. And again, their effects, when administered throughout the day over weeks and months, have yet to be calculated. The damage being caused is glaringly obvious. And the papers bear this out. There are multiple studies. So why is it standard practice over much of the world? Partly because of clinical assumptions, for example, that patients can't tolerate ventilation without deep sedation. But that's not always true. In many cases, patients can be ventilated with minimal sedation. And partly because medicine, like any profession, is shaped by habit and hierarchy. Practices are handed down. If problems aren't immediately visible, they go unchallenged. Meanwhile, ICU staff rarely see the long-term outcomes because that's not their job. They move on to the next critical issue, the next critical case. And the patient moves on alone, learning to walk again and talk again. They're alone with the strangest of memories because there's no one at any stage in their journey to listen to what they have to say. And this leads many coma survivors to question their sanity. But when people across cultures and continents and belief systems describe strikingly similar experiences where no consciousness is thought to exist, the appropriate response isn't dismissal, it's investigation. Something is clearly happening here, something we do not yet understand. And here are first-hand accounts from deep within coma of lives lived and deeply immersive experiences when, by its very nature, no consciousness should exist. That's the whole point of coma. So how can it be possible, and we've been told all along, that the brain produces consciousness, and yet the brain is registering zero activity? So I will urge those in the medical world to bring themselves up to speed on the current literature and see that safer, kinder means are available for critically ill patients. For journalists, there are extraordinary stories here. I would say seek them out, sports stars and celebrities if you can. Madonna was in a brief 2-day coma. Keep an open mind and just see where that journey takes you.